In collaboration with speech and language therapists and engineers, the team here at Queen Margaret University has helped develop new techniques that will aid children in speech and language therapy who've got long-standing and intractable problems with their speech. The techniques use ultrasound. They record the children with the therapist in clinic. The children can be assessed using ultrasound and then given treatment which replays their own articulations back to them so that they and the therapists can improve their speech by introducing new sounds that the children are able to master with that visual feedback they receive. In traditional speech therapies, children have to rely very heavily on the sounds that they're producing and the feedback they receive from their therapist about those sounds. But it can be very hard for the children to move their tongue into new positions accurately to generate consonants that they previously weren't able to produce. So for example, a consonant like a k sound is produced at the back of the mouth, and it's hard to teach and encourage a child to produce that new articulation without relying on really good information about what's happening inside the mouth. So our technologies provide that information with ultrasound by showing images in real time of how the child is trying to form those new sounds. The therapist can then use that information to guide, and together they can learn to mix new movements with the correct sounds that they're meant to produce. So for a sound like kitty cat or something like that, then if you can't produce a k, then typically that might be produced more with the tip of the tongue, and that you would have something like tit-a-tat. But the movements, if you think about how your tongue shapes a k as opposed to a t, that's difficult for me to show to you because you can't see inside at the moment. And what we really need is that extra angle to be able to sort of strip away and see the articulations. We've developed new technologies for storing and displaying ultrasound images in a way that the child in clinic can use with their therapist to shape those new sounds that they were previously unable to articulate properly. Ultimately, the research we are undertaking now and in the future will provide the evidence that will support the use of ultrasound tongue imaging in the speech therapy clinic for many, many more children in Scotland and worldwide.